What is lateral column pain? Pain on the outside of the foot, commonly known as lateral column pain in the medical community, is a fairly common occurrence. This is usually a result of some sort of twisting injury to the foot or an injury such as a sprained ankle. Lateral column pain can range from a dull pain that is only noticeable doing certain tasks, all the way up to constant pain that is present regardless of one's activity. Accordingly, the affected area may appear perfectly normal, all the way to severe swelling, redness, and bruising. Causes of lateral column pain. Narrow shoes. Without a history of trauma but with an onset of lateral column pain, the first thing that needs to be examined is the shoe that you are wearing. Fifth, metatarsal base pain. For those with a very wide flare, a shoe that is too narrow in that part of the foot will put excessive pressure on what is known as the fifth metatarsal base and in many cases will lead to pain. Peroneal tendinitis. Not only can the base of the fifth metatarsal be aggravated but the peroneal tendons can also be irritated. The peroneus longus tendon and the peroneal brevis tendon both originate on the outside of the lower leg. The tendon of each muscle travels down the outside of the ankle and then across the outside of the foot. The peroneus brevis tendon attaches into the top of the fifth metatarsal base. The peroneus longus tendon follows a more precarious course. At the level between the fifth metatarsal base and the cuboid bone, just behind the fifth metatarsal base, the peroneus longus tendon cuts under the foot and travels all the way to the first metatarsal bone. The point here is that both tendons are prone to excessive pressure that may be brought about by shoe styles that are too narrow in this part of the foot. Os peroneum. Poor footwear can also be the precipitating factor in a painful os peroneum. The os peroneum is an accessory, extra, bone that some but not all people exhibit. This is a small bone that is located within the tendon of the peroneus longus tendon at the level of the cuboid. Again, because this small bone happens to be on the outside of the foot, any shoe that is too narrow or not very supportive will have a tendency to irritate this bone. So for most people, just changing the type of shoes that you wear may go a long way in reducing lateral column pain. With no history of actual trauma to the foot, this would be the first thing to do in an effort to alleviate your foot pain. Foot trauma. In instances of trauma to the foot or ankle, the stakes become a little higher. In trauma, there is usually more damage to the outside of the foot than would be found in situations where the shoes are too narrow. Fracture. The bones that are most commonly affected would include an anterior process fracture of the calcaneus. The calcaneus is the heel bone and in cases of twisting type injuries, the front part of the heel bone may chip off. This diagnosis may be made on the basis of an X-ray, CT scan or an MRI. The fifth metatarsal base is also a very common site for a fracture, particularly in lateral ankle sprains. Again, because of the way the bone protrudes, excessive pressure from trauma will cause the base to fracture. The bone in front of the calcaneus, otherwise known as the cuboid, may also fracture. Most cuboid fractures as the result of a twisting foot injury or ankle sprain tend to be very small and may not be picked up on an X-ray. A CT scan or MRI may be a better alternative. Subluxed cuboid. Another problem involving the cuboid bone in cases of trauma is what is known as Cuboid Syndrome. This is actually a subluxation, dislocation, of the cuboid bone. Many times the movement is so small that it is missed on all diagnostic tests and the diagnosis is usually made on clinical presentation. This is a diagnosis that most non-foot specialists will miss. Tendon tear. Lastly, in cases of trauma, we need to be concerned about a tear to either the peroneus long tendon or peroneus brevis tendon. In a tear to the peroneus longus tendon we also need to be concerned about the os peroneum bone. This bone may also fracture or, depending on the type of tear to the peroneus longus tendon, may migrate, move, and thus become a constant source of pain. Tendon tears are best identified with an MRI. Treatment of lateral column pain. Treatment for most of these traumatic conditions of lateral column pain may be treated with immobilization, physical therapy, Oral anti-inflammatory medication. Cortisone injections. Eliminating the offending shoe is mandatory. In some recalcitrant cases, surgery may be indicated. Read the complete article at www.fot-explained.com/lateral_column_pain.html